Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. In my work with my clients, I help people use food and lifestyle as a way to improve their symptoms and hopefully give them their lives back. So flares are not only physically tough, they really take a toll on us mentally. The frustration, the anger, the fear that come with flares do not help them go away any faster. In fact, your thoughts and feelings can directly impact your own inflammatory process. So by shifting your mental state, you actually have some control over your inflammation. And today I'll explain why and how this is. Before I jump in, I just need to attach my usual disclaimer that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. Please consult your qualified health professional for any changes you make to your medical care. So when you are in a flare, pain pushes your body into a sympathetic fight or flight state. And this state triggers the release of pro-inflammatory cytokines, creating this vicious feedback loop. For most people, flares increase feelings of stress and frustration, both of which contribute to sympathetic nervous system activation, which again kind of helps feed that inflammatory process. However, the nervous system holds a direct kill switch for inflammation, and it is called the cholinergic anti-inflammatory pathway, and it is mediated by the vagus nerve. This pathway is controlled by the brain and sends signals to the vagus nerve to shut down inflammation. So stimulating the vagus nerve activates the parasympathetic nervous system, which directly signals immune cells to lower their production of inflammatory chemicals. So this pathway is really important for two different reasons. One, it helps prevent the immune system from overreacting and helps bring the body back into balance. And second, it has opened up possibilities for alternative therapies to treat chronic inflammatory conditions, including some autoimmune diseases. So let's jump into what are some of those alternative therapies. One of the most interesting tools that has come out of the discovery of this cholinergic anti-inflammatory pathway are vagus nerve stimulation devices. These devices fire electrical pulses down the vagal nerve and block inflammatory proteins like TNF-alpha and interleukin-1 beta. There are now two different types of vagal nerve stimulators. There are transcutaneous stimulators, which are available to anyone and can be purchased online. These devices target either the fibers in the ear or the neck, and most of them are not used clinically for autoimmune conditions, but can be helpful for things like migraines, depression and anxiety, mood disorders, pain management, and chronic stress. A lot of those symptoms and issues are also found quite commonly with autoimmune conditions. The other type of vagal nerve stimulators are implants, and these have been recently approved by the FDA for rheumatoid arthritis treatment for patients with moderate to severe RA who do not respond to traditional medications. A randomized controlled trial found participants with the implanted device had improvements in swelling and less progression in joint erosions than the control arm. It's called the set point system, and it's slowly becoming available in the US for those who, again, qualify and don't respond to traditional treatments for rheumatoid arthritis. So while those vagal nerve stimulating devices, either implantable or transcutaneous, are great, not all of us either qualify for an implantable device or really want to use a kind of transcutaneous device, especially because they're not, specifically approved for autoimmune conditions. So the good news is that there are several different non-invasive practices that you can do to stimulate this pathway. And the easiest and most practical option is breath work. So my two favorite breathing techniques are slow, deep breathing and box breathing. Slow, deep breathing is where the exhale is longer than the inhale. So breathe out longer than you breathe in. And then box breathing is equal parts inhaling, holding, exhaling, holding. You kind of imagine like a box as you're going around with doing the different breathing varieties. So both activate the vagus nerve and help down regulate stress, which then, kicks in that parasympathetic nervous system and can kind of calm things down. Another option is vocal vibrations. Things like chanting, humming, singing loudly can actually help stimulate the vagal nerve. So sing in the shower, in the car, or hum along while you do housework or other busy work. I also love when yoga instructors incorporate humming and chanting or vocal work into their practices. It's a great way to hit all the things, the breathing, the vocal work, and the exercise. Another option is cold exposure. So while that's not fun for everyone, it can also help activate the vagal nerve. For those who don't love cold showers or cold plunges, you can simply splash cold water on your face to activate what's called the diving reflex. This immediately activates your parasympathetic nervous system. And then lastly, meditation and yoga can help bring the cholinergic pathway into action. Both have been clinically shown to lower stress and lower circulating inflammatory cytokines. And I know I kind of started this discussion by mentally what you can do to shift. So a lot of those techniques, again, are mentally thinking about your stress and using different techniques to help calm things down. And a lot of this also has to do with self-talk and how you talk to yourself when you're going through a flare. Flares are not fun for anyone. They, again, they feel very scary. They're very frustrating. And a lot of times people are angry with their body because they feel like it's on attack. But really your body is just trying to protect itself when it is going through a flare. And so the best thing that you can do is just give yourself grace. Recognize that, your body is going through something, give it some extra love, and making that mental shift will also help lower your stress levels and help really cut the flare down in both duration and intensity. I know it sounds a little woo-woo, might not work for everybody, but it is something to definitely try rather than get frustrated. Really try to just be a little bit more patient and really dig into these other types of techniques that can help bring calmness and stillness to your body. So that's all I have for today. If you would like more help managing your autoimmune disease by using, nutrition or other lifestyle techniques, I would love to chat with you. I offer free 15-minute discovery calls. You can find the link in my YouTube profile. If you can't find it there, if you go to my website, AnnieRubin.com, which should also be linked on my YouTube profile, you'll find a lot more information about my services and how we can work together. I have a lot of free downloads on my website too, so check those out. And then lastly, if you don't subscribe to my YouTube channel, please hit the little subscribe button. I do try to put these videos out every week or so, just giving you lots of information to hopefully help you navigate your autoimmune disease. So thanks for joining me, and I will see you next time.